Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you for having me on the program.
Minister, the vaccines for COVID-19 continues to be big news, and we know that the first country to approve Pfizer, I believe, is the UK. So could we get a short comment on that, and basically, where do we stand? I know we've talked about it before. Where do we stand as of now?
Well, as you know, the vaccines that Pfizer is producing is what is called an mRNA vaccine. And it has now been approved for emergency use authorization from the UK authorities. And they are set now to roll it out in their country. That particular vaccine is 2 doses, so they would start that process, I think, in another day or 2. In the United States, Pfizer has also applied to the Food and Drug Administration for emergency use authorization. The hearing for that is set for the 10th of December, and once approved, the United States have already sent these vaccines out to centers within the different states. So it's already there, and once the FDA approves, then these vaccines would, people would start receiving the vaccines. So it's positive news. The challenge that we have with this particular Pfizer vaccine, while it's highly efficacious, you have a challenge with cold storage because it has to be stored at -70. And that can create some logistical challenges for the people doing the immunization. We have another company, Moderna, and Moderna has applied to the FDA in the US for emergency use authorization. And their vaccine would be scrutinized on the 17th of December. And again, it is expected that they would get the approval. And once that approval is received, they too would be rolling out their vaccine. Again, 2 doses. This one, however, they don't require the stringent temperature, so -20 is required for storage over long periods. So we have 2 really good vaccines that are about 94–95% efficacy, and that's really good news. You have some other vaccines that are around. The readouts for the AstraZeneca Oxford University vaccine was done about a week or 2 ago, and they have shown that they can reach 90%. So it ranges from 62% efficacy to 90%, depending on how you use the dosages. So that too is promising news. And what we'll have to do is to look out for more information pertaining to this particular vaccine. We also have other countries who have been producing vaccines. The Chinese have probably about 4 or 5 vaccines at different stages of development. With vaccines, you have a preclinical trial, and then when you go into clinical trials, you have a phase 1, phase 2, phase 3 clinical trials. And so the Chinese have several vaccines that are at different stages. They have maybe 2 or 3 that are at the stage 3, which is the phase 3 clinical trials. But they have also been using it more widely for persons who want to get the vaccine. Their local authority, their equivalent of the Food and Drug Administration, have given that vaccine emergency use authorization. Similarly, you have the Sputnik V vaccine from Russia, and their national authorities in Russia would have given emergency use authorization, and that vaccine is being used in Russia. I think some of the makers of these vaccines have also applied to the WHO for pre-qualification of the vaccine. So many of these vaccines would undergo that program of pre-qualification. So in terms of vaccines becoming available, I think that's really good news. And we have, as you know, been part of the COVAX facility. And COVAX really is a global mechanism to ensure that both rich and poor countries are able to have access to vaccines. And because you would be buying in bulk and you're able to negotiate with these big companies and to ensure that you have some amount of vaccines. If it's left to the persons with the most money going and get these doses, then only rich countries would probably be able to afford it. So COVAX really is helping to bring some equity and to ensure that poor countries as well are able to access vaccines. The challenge that we have globally, this is a pandemic, meaning that almost all countries in the world have been affected. And if you only focus on immunizing parts of the world, meaning the more developed countries, you will still have the disease circulating in other populations. And very quickly, you can see another surge. So the idea is really to make sure that as many countries as possible are able to have access to the vaccine, and hence this is why COVAX was created. Now, with COVAX, what they're planning to do is to ensure that every country, sometime next year, would get about doses for about 20% of their population, of which we would start getting the first 3%, and they're asking countries to prioritize that 3% more towards frontline workers, which would include the healthcare workers and perhaps other persons who are constantly engaging the public. So the first 3% would go to those persons, and then the other 17%, it is yet to be determined. But in our context, we are leaning more towards having the elderly and also persons who have comorbidities, because these are the persons more at risk. So yes, we have made some progress in terms of acquiring, because COVAX now is very clear. They have sent us some documentation which we are filling up and sending them back to them. And while we're working with them to access the vaccine, we have also started work locally, which include looking at our vaccination sites and improving our cold storage, expanding that cold storage. In some cases, we have to add new storage rooms and things like that. We have also started acquiring the types of freezers that we'll need for the vaccines. So we have been in that process of procurement to get those freezers. And of course, we have to train healthcare staff to be able to administer the vaccine. So we have started the preparatory work for that training, developing the manuals for training and so forth. And within a couple of weeks, we will be able to bring in people and start doing this training. So while we wait on COVAX acquiring those vaccines for us, we are also preparing internally and making sure that we are ready, so whenever a vaccine is available and we get that vaccine, that we can quickly roll it out.
All right. You mentioned that you're acquiring the storage facilities. Would you be able to say when we'll be probably getting the first equipment or so on?
Well, we now start, and as you can imagine, with vaccines around, there's a global rush. So we don't have form ETAs as yet, but we have started the process.
Let's look at the antigen test training that's ongoing. How is that progressing? Sorry, from vaccine straight over to training. We discussed training yesterday, and you did indicate that by the end of the week that the health workers would be taking back some of those test kits with them. Just how is the training going so far, and how many persons are involved in the training right now?
So we had some training for the staff of the Georgetown Public Hospital and some of the laboratory staff, and that training went very well. It's about 3 or 4 hours that they were there. And apart from the theoretical aspect, they went through some of the more practical things using the actual kits so that they can familiarize themselves with the use of the kits. So they have completed that, and we have been able to give the Georgetown Hospital a number of kits so that they would be deploying that in their facility. We had probably about 30 people or so who were trained yesterday. That training continues today, but it is for persons coming from the region. So we're training a group of people who would be like trainers, and they would go back to their respective region and then train other persons in the region. So today we have another 20 or 30 persons who would be undergoing such training. And again, once they complete the training, we'll give them kits to take back to their respective regions.
We were told that the World Health Organization, sorry, from that, another one, they issued some new guidelines for face masks. Could you enlighten us about that? And are there any particular changes that we should know about?
I think more or less the guidelines are pretty straightforward. We have known about these things from a long time. And we have, in Guyana, we have been advocating and practicing the use of masks. Unfortunately, in some other countries, there's still a big debate whether or not to use masks. But a lot of the scientific studies would have shown that masks actually help with the reduction of transmission. Now, there are different types of masks, and depending on your environment, whether there's a higher risk for COVID-19, then you have to choose the appropriate mask to wear. For healthcare workers, there are two basic types that are really recommended. You have surgical or procedural masks that can be used. And these are used more or less within the hospital. N95 mask, which filters more particles out. They are used where you have what is called aerosol generating procedures. So if you're putting down a tube down somebody's throat or something, there's the possibility of generating aerosol from that patient who is infected with COVID. And therefore, the guidance would be that you use the N95 mask along with other personal protection equipment. So N95 mask really is for a more selected group of people who would be at higher risk for infection. So when you're prioritizing the use of it, the persons who are in direct contact with those COVID-19 patients should have their N95 mask and PPEs. Persons who might be around the environment but have no direct contact with these patients are at a lower risk, and therefore they would not need to be wearing these types of N95, and so a surgical or procedural mask can work as well. Then, apart from these two, we have masks that are made of cloth, and their recommendations, you can use 3 layers of cloth, and that also helps to prevent transmission. So for a relatively lower risk environment, like walking on the road, going into a public space, a cloth mask can help with your protection. And that is the one that is generally recommended, that people use that. and protect themselves when they're in public spaces. Now, you also have, depending on your environment, the risk of COVID-19 can go up. So if you're in a crowded, indoor, under-ventilated environment, then your risk can go up because you don't know who is the person next to you. And especially if you are in environments where you can't keep social distancing of more than 3 feet. So again, coming back to the holiday seasons that are coming up, if people are going to go do shopping and crowd into shops, you can have potential challenges because what would then happen, people would not be able to maintain social distancing, and also you would have, be in close contact, you'll be crowded. Some of these shops are not adequately ventilated, and therefore you will have the conditions for COVID-19 to spread, because again, we don't know who is carrying it and who is not carrying it. So these are things that I think people have to bear in mind, and we want to encourage persons to ensure that they wear their mask. Guyana has a mandatory policy on mask use in public spaces, and we are asking people to please comply with wearing the mask in public spaces, because it would really help us to reduce the amount of cases that we are getting.
Okay. Minister, before we wrap up, we have a question from Loop TT in Trinidad. They're asking what government has in place to deal with those issues, mental issues that will come out of COVID-19. We've spoken about this. We know that there is ongoing training right now.
So we have been doing a couple of things. We don't have enough psychologists and psychiatric doctors to be able to reach out to everybody that might need that type of assistance. So one of the things that we have been doing is to train primary healthcare doctors so that they can recognize signs and symptoms of mental health challenges that people might have. And by expanding that pool of people, we are confident that we'll be able to detect more cases and offer more help. And that's the rationale behind the training that we have just concluded. We had a number of persons who were trained, and they're now using their skill set in the primary healthcare setting. Apart from that, we have just launched a hotline. And through that hotline as well, if there's anybody out there who got any kinds of problems, they can call the hotline. It's manned 24/7, and you would be able to talk to a professionally trained counselor who can walk you through, the different challenges that you might be having. So we see this would help people in a lot of ways. And these are two measures that we have put in place. This does not preclude people from coming to their regular clinic. If they're a known patient or so forth, they'll be getting support from their clinics. And in addition to that, we have other phone numbers for persons who have to be in home quarantine or in home isolation. So again, we have a different team of people that are working on those issues. So we have, I think we're trying to get more, and even in some cases to regionalize the effort. But as of now, at least you have these national hotlines that are available.
Okay. All right, Minister, thank you so much. But before we go, just a quick update from our regions, Oriala, Siparuta, and of course, St. Cuthbert Mission.
Well, St. Cuthbert's Mission, the cases have been going down steadily, and we are quite happy with that. So we are now down to about 13 cases. At Oriala and Siparuta, Oriala, I think we have about 31 cases, Siparuta 49. Those cases we expect in another couple of days would be reduced because As I said before, most of those cases are asymptomatic people, persons who have tested positive but have no signs or symptoms of the disease. So we expect that their 10 days would be up shortly, and we'll be able to discharge quite a number of them. So in a couple of days, you will see the cases going down. We have about 19 cases in New Amsterdam, so that is something that we are monitoring very closely because we know there were a couple of areas where the spread of this would have occurred, and we are tracking the people who would have been at these events to do the contact tracing. So these are, apart from Region 6, we also continue to monitor the Bartikari area because we have 62 cases there right now, and we are expecting that to come down in a few days as well. So these are really our current hotspots, and we keep engaging our medical team and to see what else we can do. But again, most of the persons that we've been monitoring are asymptomatic, and therefore we don't foresee any major challenges.
Minister Anthony, again, thank you so much.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we've just spoken with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.